So our topic for today, it's one of my favorite things to talk about, one of my favorite things to help women with, or anyone really, and that's returning to running. So I myself am a jogger. Compared to some of my clients and the people that I've worked with and friends, I don't think I could call myself a serious runner, but I do love to jog. I've done a half marathon, and jogging and running has really been my primary form of exercise as well as stress relief. Since I had my kids. So I know a lot of women are in the same boat as me, where that's really the easiest way to just get your heart rate up and feel like you've had a great workout, is to just go out there and run a few miles. Or if you're a serious runner, running your marathon or participating in your Ironman, it can be really frustrating to not be able to do that at your prior level, or to not be able to do it at all, whether it's during a pregnancy, after a pregnancy, or really after any kind of injury. We're going to talk about returning to running really after any kind of injury, or any period of time where you can't run, any time where you're sedentary, or you're just not able to do your sport for a while. And pregnancy is a big one of those, one that we see a lot in our practice as pelvic floor therapists. So we're going to talk about that today, because there's a right way to go back to running and there's a not great way to go back to running. So ideally you are smart about it and you return to running the right way, which can help you prevent injuries, discomfort, pain, and issues down the road. So you want to be able to run well in the long run and run comfortably in the long run, and not just in the short run. So that's what we're going to talk about. So to dive right into it, how do we get back to running the right way? The first thing you want to consider is, what were you doing before? So before this period of time where you were unable to run, what were you doing? What was your mileage like? What was your speed like? What was your, what were you doing before? What was your intensity like? And then for how long? So have you been a runner all your life? You've had all the coaching, you know about proper form, you know about good technique, you're well educated, you've been running your whole life? Or did you just barely start running before your current issue happened, right? Or your issue that's just now ending happened, whether it was a pregnancy or another injury. How long were you running for before that occurred? And then when did you stop and why? So how long ago did you stop? How long has the rest break been? And why did you stop? Because it makes a difference. So if you were a runner all your life and then you ran through most of your pregnancy, maybe it was modified, not as much as you're used to or not as intense, but you did continue to run through your whole pregnancy up until that last couple of weeks, and then maybe you stopped for a few weeks, and now here you are at your 6-week postpartum checkup. Your physician or midwife has told you you're cleared to run, and you've really not taken that much time off. That's totally different than someone who maybe started a running program a couple of years ago, then they had fertility challenges, so their physician told them to stop aggressive exercise, so they stopped running. It took a year and a half to get pregnant, so they didn't run that whole time. And then now here they are, 12 weeks postpartum, their physician has cleared them to run. So it's been probably 2 years, closer to 2 years since you've done any running. And what you did do was more at the novice level. You never really built up a huge repertoire as a runner. Okay, so that's two very different scenarios. Let alone somebody who you're not even dealing with a pregnancy or a postpartum condition. You just had an ACL reconstruction and you tore your ACL skiing, and you were never really a runner, but now you want to pick it up. Or you were a runner before and you had a hip replacement, and now you'd like to pick up running again. So these are very different scenarios. These are very different types of people who are going to return, and the plan is going to be different, right? So the considerations are going to be different. So the first thing you want to consider is, we'll say that again, what kind of running were you doing before? What kind of running were you doing before? How long were you a runner for? And when did you stop and why? So those are the first questions, right? Those make a difference. Second thing I want to mention is, are there signs that something is still wrong? Okay, so you want to think about, what is your current status? After we consider your history, what is your current status as a runner? Do you have any signs or symptoms that there's something not right in your body? So this can be pain, it can be pubic symphysis pain, it can be maybe a little bit of knee pain or hip pain, it could be some low back pain, it could be leakage, right? So it could be bladder issues, you have urgency, you have a little bit of incontinence, you have feelings of heaviness. So let's say you're now up to walking, you're walking a few miles every day, but most of the time when you walk, by the end of your 30 or 45-minute walk, you don't feel great in your pelvis. Maybe things feel a little bit loose, you feel some pressure, or maybe it's not till that night you feel some pressure at the end of the day. So just feelings that something's still not quite right in your body. A lot of postnatal women might have tailbone pain, right? And tailbone pain is kind of an interesting one. I'm not going to delve into it too much, but a lot of women postnatally have tailbone pain because they're sitting so much. Okay, so you had this possibly traumatic thing happen in your pelvis, right around your tailbone, and then now you've just been doing mostly sitting for the past few weeks as you feed your baby. So that can be a cause of tailbone pain, in which case I would usually suggest that getting more active is going to be helpful for that. Okay, but again, we're not going to delve too much into tailbone pain today. Maybe on another Facebook Live we'll do that. But signs that something's still not right: hip pain, back pain, leakage, feelings of falling out, anything that's an indication to you that something's not quite right. Okay, so we want to consider that as something that's going to be your body telling you that you're not quite ready, especially if it's with activity, with more aggressive activity or with prolonged activity. Those are signs and symptoms that maybe your body's not quite ready to just jump right back into your running program. Okay, so next thing I want to mention is, how do you prepare then, right? Once you've considered all those factors, how do you prepare if getting back to running soon is your goal? So specifically for the postnatal woman, if it's really important to you that you get back to running when your physician clears you at that 6-week mark, then how do you prepare for that, right? How do you get ready? Because after any injury, any sedentary period, jumping right back in after a 2-month break is not necessarily a great idea. There are some things that you want to do to prepare your body for that increased load, for that activity, and we're going to talk through some of the specific things. But one of the ways that you're going to prepare for your return to running is to consider the things that we just talked about and have those enlighten your plan for getting back to running. Okay, so if your goal is to start running at a certain point, like a 6-week postpartum mark, you're going to look at that history, look at all the factors, and then you're going to look at, okay, what do I need to do? How long does my preparation period need to be? How much effort do I need to go through to make sure that my body's ready to start running at that time? Okay. That goes for any kind of injury, any kind of sedentary period, including pregnancy and postpartum. Now, specifically with the pregnancy and postpartum scenario, we've got very specific things that have happened in your body that are going to impact the ability of your body to tolerate and be effective at an activity like running, which is a high impact activity. Okay, so there are forces that go through your pelvis and through your spine, and we know that with pregnancy, you have changes in your pelvis and your spine. Whether you have a vaginal birth or a cesarean, you're going to have changes in your core muscle. You're going to have changes in your ligaments, in your fascia, in your connective tissue, potentially in your bony structure, in your muscle mobility, and certainly in your strength and awareness, and especially awareness and reaction time of your pelvic floor and your core muscles. So your deepest core muscles, your diaphragm, your transverse abdominis, your pelvic floor, your multifidi, your deep hip rotators, your spinal stabilizers, those all can be a little bit shut off after a pregnancy, and they're not used to being in the position that they're in now, because they've been gradually changing position, changing their environment in which they're functioning over a 9-month period. And then there's a rapid change when that baby comes out. And now the muscles and the nervous system can be a little bit confused or not quite sure about how to effectively stabilize your spine and your pelvis, how to most effectively breathe, how to most effectively maintain continence from your bladder and your bowel perspective. So there's some work that you may need to put in to preparing those structures for return to impact, because impact is very different. It's a lot more load than something like a squat or a lunge or a bridge or a nice slow controlled movement. Okay, impact happens fast. It happens a lot of times in a row if you're going running even for 10 minutes. Okay, so some things that we want to consider when we think about going back to running: glute strength. Okay, so we just talked a little bit about core. Your pelvic floor, your core musculature needs to be up for the challenge. Okay, so for example, if you had a cesarean section, you have some numbness still around your incision. You can't really feel very well what's happening in your abdomen. You're going to want to prepare those muscles, right? So we need to know that those muscles are able to turn on and support your spine. Your pelvic floor, same thing. If you've had a vaginal birth or a cesarean, but primarily we'll talk about a vaginal birth, they've been through a lot of stretch, right? They've been through a long period of loading. They've been through aggressive stretch. Potentially they've been torn. They've been cut during your delivery. So, we need to make sure that your pelvic floor muscles are up to the challenge of absorbing shock through impact. Okay, so to backtrack a little bit, so we talked about glute strength is incredibly important. So your glutes, they're like the powerhouse of your pelvis, right? So when you're talking about running or even walking or jumping, your glutes and your hip flexors, but we're going to simplify here. So your glute strength is very important, because if you think about your pelvis, and I don't have my pelvic model at home right now, it's at the clinic, but if you think about this pelvis that you have as roughly this kind of a shape, and then you've got your legs coming off either side, right? And you've got your spine running up. So you've got this pelvis that's all surrounded by muscle. And anytime you're weight bearing, your pelvis is extremely important in the function of your whole body. Now, when you walk or when you run, you're going through a pattern of rotation, of asymmetrical loading as you go from one single leg stance to the other single leg stance. So you're going single leg, single leg, single leg, single leg. And depending on what your gait is like and whether you're walking or running, there's going to be different amounts of forces going through each leg as you go through that gait pattern. So your glutes are one of the primary muscles that are holding you up, that are holding your pelvis in a stable level position as you go through that single leg loading pattern and alternating back and forth. So if your glutes over a period of rest or a period of injury or a period of not running and not strengthening, if they've lost some of their strength and their ability to control the pelvis, then when you go back to running, you're going to have a lot more translation, a lot more lateral shift, a lot more. It's not going to be a nice stable structure to support the body while you're running, okay? And it's not going to be stable to support the pelvic floor, which is still healing while you're running, okay? So if your glutes are not strong, you're going to have a lot of excess motion through the pelvis, and that can really contribute to things like hip pain, knee pain, back pain, SI joint pain, sciatica, pubic symphysis pain, and it can contribute to incontinence, right? So it can contribute to those feelings of falling out in your vagina and actual falling out of urine or stool, okay? So leakage. So glute strength is extremely important. When we talk about incontinence in particular, we can't just talk about the pelvic floor, especially when we're talking about jumping, running, things that you're doing in a weight-bearing environment, because the pelvic floor doesn't work by itself, okay? So it needs your glutes to support it. Your knees need your glutes. Your hips need your glutes. Your spine needs your glutes, okay? So the first thing is we gotta make sure your glutes are strong. That's one thing to think about when you think about going back to your running, how strong are my glutes, okay? Core, I got ahead of myself and I started to talk about a moment ago. So your core musculature, your abdominals, your spinal muscles, your diaphragm, and your pelvic floor. So most people think core is abs. Core is not abs, okay? Your core, and different people have different views about what's included in your core, but kind of a very global description of it is going to be the muscles that kind of create your center and hold everything nice and stable no matter what type of movement you're doing. They're required for any type of movement, and very much so for a dynamic and aggressive movement like running. So the core musculature includes your diaphragm, your pelvic floor, and your spinal muscles, not just your abs. So you need to make sure that that whole center part of you, your whole trunk, is strong and ready for load and impact, okay? So one of the first ways we get back to doing that is with practicing breathing with good mechanics, right? So you can see videos on my YouTube page and on my Facebook, on my YouTube, on my Instagram, pelvic PTs, we talk about breathing all the time, okay? So it's pretty easy to find some good instruction out there on how to look at your breath pattern and see, is it an optimal breath pattern? Are you using your diaphragm well before you go back to running? Because what do you do when you run? Your respiration rate goes up. So your diaphragm is now working harder because it needs to get an oxygen, right? That's one of its primary jobs. But it's also a stabilizer of your rib cage and your spine and your pelvis. Believe it or not, even though it doesn't directly attach to your pelvis, your pelvic floor and your diaphragm work in unison together with your abs and your spinal muscles to hold everything stable. So breath is very important for that, and whether or not you can control everything while you're breathing is very important, okay? So you need to be able to load your body, breathe at the same time, and have your diaphragm be going through a nice, normal excursion and pattern of movement. Okay, spinal muscle is super important. Pelvic floor we already talked about a little bit. So we need to make sure that your pelvic floor, if we talk about your glutes sit on the outside, your pelvic floor is sitting on the inside. It's not just about bowel and bladder and sexual function. It is about pelvic stability. It is a core muscle. So if your pelvic floor is not well healed, if you're 6 or 7 weeks postpartum and you had a 3rd-degree tear through your pelvic floor, you've got muscles that are interrupted and they are not healed at 6 weeks. Okay, 11, 12 weeks, probably, maybe, okay? So if you have your pelvic floor and you had a big tear, right, these muscles, which normally support your pelvic girdle, your SI joints, your sacrum, your lumbar spine, and your hips, if those are not healed yet, if they're not functioning, and signs of that, again, you know your pelvic floor is not functioning well if you're leaking, if you have feelings of falling out, okay, if you have pain in the vagina, or in the rectum or at the tailbone, all right? So pelvic floor, we want to start activating that. And again, I have a lot of videos on my website, on my YouTube channel, and on Facebook and Instagram about, how do I start connecting with my pelvic floor? All right, so pelvic floor and mechanics. So we want to think about running mechanics, okay? Because how you're holding your body, how you are moving your hips and your knees and your spine, and how you're holding yourself as you run is going to make a huge difference. So if you have postural changes from pregnancy or from a period of injury and being sedentary that you're carrying into your running pattern, that can be detrimental and set you up for injury down the road when you start really training for that longer distance or for that race you want to run. If you're not setting yourself up with good mechanics, then no, you might not have an issue with running 3 to 5 miles. But when you start trying to hit your PRs at your 10 and 13 and 20 miles, you might have some issues, okay? So we want to make sure that your mechanics are dialed in. So I did talk a little bit about impact, okay? So impact, the difference between running and doing things like squatting and lunging and bridging and, more strength training is the impact. Okay. Now the impact, the reason that this is a huge deal postnatally or post-operatively is that impact requires your muscles to be able to function without you thinking very hard, okay? So even if you're gonna do a squat, you have time to prepare in your brain, how am I gonna move? You might have a mirror that you're looking in to make sure that your mechanics are good. You have time to plan and think about a motor pattern. What am I gonna activate? How does this movement feel? What are my joints doing? You have time to think about that. As soon as you go to like a rapid jump, like a jump rope or rapid fire jump squats or running, you now no longer have the time and the opportunity to think about every movement that you're making. These are many, 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 many repetitions in a row that are too fast for you to think about and plan. So your body needs to be doing these things automatically, okay, without you having to think about them. It does not work for you to just hold your abs and your pelvic floor tight and run for 10 minutes. Nobody can do that. It's not really that good for you to try to do it, okay? These muscles should be turning on in an orchestrated fashion prior to you running. So again, back to if you have symptoms of that things are not right, it probably is an indicator that they're not doing that. And that's why you may not be quite ready to run, okay? So, impact, you have shock absorption happening, and shock absorption happens at many joints in your body, okay? It happens in the foot, it happens in the ankle, in the knee, in the hip, in the spine. Shock absorption happens the whole way up the chain, and your core musculature is one of the primary muscle groups that is going to control that shock absorption. So again, you have some core muscles that are very impacted after pregnancy that are very important in absorbing shock. And if your pelvic floor cannot absorb shock well, you better believe you're probably going to have some issues with incontinence. Okay, and that doesn't mean that can't be retrained. We can retrain your pelvic floor to absorb shock, just like we can retrain your ankle to absorb shock. We can retrain your knee to absorb shock after a knee surgery. We can retrain your hip or your foot after any kind of, after an ankle sprain. That's what PTs do. We train those joints to absorb shock again well. We make sure that they have good mobility so that they can do that in the right way. Same goes for your pelvic floor. Same goes for your abdominals and your core musculature after a pregnancy. So that impact is very different from, again, a slow, controlled movement. Plus, when you try to go for a run, even if it's a 10-minute jog, it's a lot of repetition. So your musculature needs to be able to control that and absorb that shock without you having to think about it. It needs to be automatic for a lot of repetitions over a long period of time. So how do we start preparing for that? Well, we start retraining these things prior to the date that you want to go running, okay? So if you have an ACL reconstruction, you have a lot of rehab of your whole lower extremity and your core before you return to sport, before you start doing impact, before you start doing heavy duty sport specific training. There's a lot of lead up to that. And postpartum often needs to be the same way, especially if it's been a long time since you ran. There's gonna be some cross training, some strength training, some control training, some coordination training that needs to happen before you take on that impact, to make it automatic so that you don't have to think about it and your body just does what it needs to do on your own, so that when I tell you, hey, I think we're ready for you to go out for a jog, this is how I want you to do it, this is the kind of intervals I want you to do, this is the kind of surface I want you to run on, this is what I want you to try, but we need to be confident that your whole body is ready for that, all right? And for a lot of women, it just happens, you guys. So if you're one of those people that just was able to go back to running without any kind of training or lead up or rehab, great, good for you, that's awesome, I applaud you. But that's not the scenario for everyone. So for those of you who are not having that experience, please, please, please see a qualified pelvic floor physical therapist so that we can help you get back to that activity, because it doesn't mean it's over for you. It just means we need to retrain some things, okay? So kind of back to my little rant here. So we talked about impact. Your pelvic floor and your core needs to be ready to absorb shock rapidly for hundreds of repetitions without you thinking too hard about it. Your birth story matters, right? So if you had a C-section versus a vaginal delivery, if you had a big tear versus no tear at all, if you have scar tissue, if you have spasm, that matters, okay? If you had no real exercise for 2 years leading up to the birth versus if you were exercising right up till the end, it matters, okay? So everyone is not the same in terms of what they need to do to prepare to go back to running. And another just statement I'll make that I make in almost everything I talk about, your physician or your midwife telling you that you're cleared to run at your 6-week checkup does not mean your body is really ready to run. It means that you're not creating a medical threat to yourself by going out to run. It doesn't mean that you're going to be successful and effective and feel good doing that activity. That's the physical therapist's job. It's our job to get your body really ready to start running in an effective, pain-free, comfortable, healthy way that's not going to cause you problems down the road, okay? Because a successful return to running means that you're running pain-free with no leakage, no feelings of falling out. It doesn't mean that you're throwing on a pad, you're wearing your black pants, you're putting a grin on and you're banging it out even though your body is not tolerating it well, okay? And we want you to have a successful return to running that feels good and that's gonna last a long time and not require you to backtrack in a year when you finally realize you're not ready and things are not going well, okay? So we'd rather have you do it right from the beginning. So a couple things I wanted to give you guys specifically. I want to give you some specific tools. Okay, well, what can I do then, right? So we talked about refer back to some of my other videos, my blog posts on pelvic floor, on diaphragm, on deep core activation, on all of those things. But what are some good ways to know if you're if your stability is good. So there are a few little exercises that I will typically give people to kind of start to feel out, are you ready to start running? Is your pelvis ready? Is your pelvic floor and your core ready to stabilize your pelvis and your spine and move well in a good symmetrical way with single leg loading and with impact, okay? So here we go. First thing I love to do before we start doing anything big aggressive, if we're starting at a lower level, single leg bridges, okay? So a lot of people are familiar with the hip bridge. It's just laying down, lowering your hips up and down. With a single leg bridge, let me adjust this so that you guys can see me. With a single leg bridge, now we're taking you into that single leg loading, okay? So being able to support your spine and your pelvis in a double leg supported stance is totally different than being able to do that in a single. Sorry guys, I'm just gonna move you down here. That way my camera won't fall over. Okay, so a single leg bridge. What are we looking for? We want your pelvis and your spine to be able to stay nice and neutral and stable as you do a single leg activity. And a bridge is gravity eliminated. So it's a really nice basic place to start to see what is your body capable of. So you're lifting the hips. I usually have feet narrow, okay? And then you're gonna lift one leg and you're gonna feel, can I keep my pelvis stable? Can I keep my spine neutral, right? And I'm marching back and forth. Okay, that's pretty easy for me. So now I'm gonna hold that one leg out and I'm gonna go through some repetitions, right, of hip extension and flexion and feel, can I hold my pelvis nice and level? And my other leg is tracking, it's not compensating, right? So a single leg bridge, if you can do that well, is a really nice exercise to start to see if your, I don't know where I'm looking now, if your body is ready, okay, for that single leg loading. Second one that I really like, which is getting a little bit more into a gravity type of position, is going to be lunging. Okay, so a squat is something that will have you start doing really early. Okay, squat is double leg load. It's nice. You can weight bear through both legs. So it's a great way to start strengthening, but it doesn't tell us much about how you're going to do with running. With a lunge, now we're going in an asymmetrical pattern. So now we have to control the rotation of the pelvis and you're loading your glute a lot more. Okay, so lunging, I want my ladies or my clients to be able to do quite a few lunges in a row with a nice stable pelvis, good breath, good spinal mechanics. That's a sign to me that you're probably ready to start amping up towards running. Okay, so lunges are great. Another one is single leg deadlift. So a single leg deadlift, again, you're loading one leg, you're balancing, you're holding your pelvis level, and then you're moving through a range of motion and you're really seeing, can I breathe? Can I sustain my weight on a single leg? Oh, there goes my balance, right? I'm trying to look at the phone and move at the same time. So, can I move and balance on one leg, and are my muscles able to control me? Can I breathe while I'm doing that and keep a nice stable spinal position? So single leg deadlifts are a great one. So then adding in some impact. So I usually start my clients with, again, that double leg stance, right? So can we hop? Now, can we hop with leg movement, with asymmetrical movement, and testing that out? So if you can't do that without symptoms, your body's probably not quite ready to run, right? So these are ways that you can test out, am I ready? And then things that you can work on progressing to get you ready, okay? So the last thing I'm gonna talk about return to running is when you have done those tests, you're confident that you're ready to return to running. Now, how do you get back to it, right? So gradually, right? So we want you to go through a nice gradual planned progression where you're using intervals. You're jogging 30 seconds on, 30 seconds off. You're at a nice, moderate, well-controlled pace. You're focused on your breath, on your posture, on your mechanics, on feeling good, but you're testing the waters by doing some intervals, okay? And starting a little bit slower, and then gradually over time, as your runs are feeling good, you can increase your speed, you can increase your intensity, and you can increase your distance. You can start bleeding those intervals closer together. Okay, so that is all I have for my notes on this topic. So hopefully, let me just go back, see if I can see you guys on my Facebook page. Any questions so far from anybody that's watching? Just kind of type them in there. I don't think we have too many people watching this live right now, but if you have any questions, go ahead and type them in the comments. Otherwise, we will wrap it up. Hi, Arlene. Does no pain and no leakage and no feelings of falling out mean that it's safe at 8 weeks postpartum? Okay, maybe. Right? What else have you been doing? Okay, so if all you've been doing is staying in and around the bed and the house, we don't have much information there, right? You haven't been testing, you haven't been loading much. So if you've been very sedentary and really just been home taking care of baby, which is fine, that's totally fine, and you have no pain with your normal day-to-day activities, you have no pain with, if that's all you have no pain and no leakage with, I would want a little bit more information. So again, I'd want to start, let's have you start to test some things, like the ones that we just talked about, the bridges, the single leg bridge, the lunges, the squats, the single leg deadlift. I don't know if I already said that. So go ahead and start trying some of those more slow, controlled activities. Can you do them well with no soreness, with no pain, with no leakage? If you can, go ahead and step up to the next level, right? Start trying a little bit of impact, okay? Because again, like your birth story matters, right? So if you had a big tear or a C-section, then I am a little bit more concerned at 8 weeks, purely because the physiological healing time for your injuries is more than 8 weeks, okay? You have a very fresh scar at 8 weeks postpartum. And if you have questions about healing time and normal healing times, I will refer you back to the Facebook Live that I did last week, where we talked in great detail about healing times for incisions for perineal tears and lacerations. And that would include a C-section incision also. So, you know, it takes longer than 6 to 8 weeks for those injuries to heal well. You're at 50% of your tissue integrity, tissue strength for a year to 2 years. That doesn't mean I don't want you to run for a year to 2 years. I'm just highlighting the fact that you know, you're not necessarily all better and all healed if you have a big tear or a laceration or an incision. So if you have no pain, no leakage, no feelings of falling out with your normal day-to-day activities, you've been walking 45 minutes to an hour, 5 days a week, you've been adding in some hills, you know, as is appropriate to do at 8 weeks postpartum if you have no pain and no issues. As are some of the lower level exercises that we just talked about. And if all of that feels good, you're probably, right? But I would need more information. So hopefully that helps. That's my vague answer. I'm not allowed to give any medical advice on Facebook Live, okay? So I have to keep what I say pretty general. And in the education realm, obviously I can't diagnose or treat anyone, you know, via this format. So hopefully that helps, but it sounds like you're definitely in a much better place than someone who is having those issues, right? So you're much more likely to be ready than someone who is having some of those symptoms with their normal day-to-day activities or with any of the other kind of tester exercises that we just talked about. Hopefully that answers your question. Any other questions? This will be, I know we just had somebody join us. This will be recorded and live. You can watch the whole thing later, so.